Understanding learning disability and autism. Definition of a learning disability. A learning disability is a lifelong condition that affects each individual differently and cannot be cured. It is typically classified as mild, moderate, severe, or profound, depending on the level of support a person requires in daily life. According to the World Health Organization, an intellectual disability is defined as a condition of arrested or incomplete development of the mind, particularly characterized by impaired skills that emerge during the developmental period and affect cognitive, language, motor, and social abilities. The World Health Organization (WHO) classifies the severity of intellectual disability using approximate IQ ranges and associated developmental characteristics. Mild, IQ between 50 and 69, equivalent to a mental age of 9 to under 12 years in adults. Individuals may experience some learning difficulties in school but can often live independently, maintain relationships, and contribute meaningfully to society. Moderate, IQ between 35 and 49, mental age of 6 to under 9 years in adults. This level is typically associated with significant developmental delays, although many individuals can acquire basic communication, academic, and self-care skills. Some independence is possible, with varying levels of support required for living and working in the community. Severe, IQ between 20 and 34, mental age of 3 to under 6 years in adults. Individuals often need continuous support for daily living and may have limited communication and learning abilities. Profound, IQ below 20, mental age under 3 years in adults. This classification involves significant limitations in communication, mobility, continence, and self-care. Individuals will require full-time care and support. These categories highlight that learning disabilities can present very differently from person to person. It is important to note that the term learning disability should not be confused with learning difficulties such as dyslexia or ADHD. Unlike learning disabilities, learning difficulties do not affect overall intellectual ability. However, an individual with a learning disability may also have one or more learning difficulties. A person with a learning disability may have challenges with understanding complex information, learning new skills, managing daily living tasks, or living independently. What causes a learning disability? We do not always know why a person has a learning disability. Sometimes it is because a person's brain development is affected, either before they are born, during their birth, or in early childhood. This can be caused by things such as the mother becoming ill in pregnancy, problems during the birth that stop enough oxygen getting to the brain, the unborn baby having some genes passed on from its parents that make having a learning disability more likely, illness, such as meningitis, or injury in early childhood. There are some health conditions where you may be more likely to have a learning disability. For example, everyone with Down syndrome has some level of learning disability, and so do many people with cerebral palsy. Some people with epilepsy also have a learning disability, and so do many people with autism. Learning disabilities occur when the brain does not develop as expected before, during, or shortly after birth. Some known causes and risk factors include genetic and chromosomal conditions, for example, Down syndrome, Rett syndrome, Fragile X, Williams syndrome. Congenital brain malformations, for example, spina bifida, hydrocephalus, microcephaly. Prenatal exposures, for example, alcohol, sodium valproate, rubella infection, Zika virus. Birth complications, including lack of oxygen to the brain or cerebral palsy. Extreme prematurity, typically before 33 weeks gestation. Serious childhood illnesses, for example, meningitis, encephalitis, measles. Traumatic brain injury during childhood, for example, accidents, physical abuse. Severe early neglect or lack of stimulation. In many cases, the exact cause of a learning disability remains unknown. Related terms. Global Developmental Delay (GDD), a term used in children under 5 when developmental milestones, for example, speech, movement, learning, are significantly delayed across multiple areas. If delays persist, it may later be classified as a learning disability. Cognitive impairment, a general term for difficulties with mental abilities such as memory, attention, or problem solving. In the context of learning disability, it refers to limitations in intellectual functioning that affect reasoning and understanding. What is autism? Autism was first identified in 1943 by American child psychiatrist Leo Kanner, who described a pattern of behavior characterized by difficulties in social interaction and communication, alongside repetitive behaviors and restricted interests. Today, autism is recognized as a neurodevelopmentally condition where individuals may struggle with communication, social interaction, and sensory processing. It is often referred to as Autism Spectrum Condition (ASC) or Autism Spectrum Disorder (ASD), reflecting the broad range of ways in which it can present. They may find it challenging to understand others' perspectives, feel overwhelmed by sensory stimuli, and experience anxiety in unfamiliar situations. Processing information may take longer, and repetitive behaviors or thoughts are common. Recognizing these differences and providing support tailored to individual needs is crucial for individuals with autism to thrive. The medical name for the condition is autism spectrum disorder. Some people use the term Asperger's syndrome to describe people with autism. However, the doctors do not diagnose people with Asperger's syndrome anymore because it's now thought of as part of autism spectrum disorder. People with autism may find it hard to communicate and interact with other people. Find it hard to understand how other people think or feel. Find things like bright lights or loud noises overwhelming, stressful, or uncomfortable. Get anxious or upset about unfamiliar situations and social events. Take longer to understand information. Do or think the same things over and over. However, if someone with autism receives the right support, they can live gratifying lives. Characteristics and behavior. Autism spectrum is characterized by various characteristics and behaviors that manifest primarily in social engagement and recurrent behaviors. However, not all people with autism will have all behaviors. The signs may differ based on the demographic. Early signs of autism in young children. Signs of autism in young children include failure to respond to their name being called and avoiding eye contact, lack of reciprocal smiling and not responding positively to smiles directed at them, getting very upset over certain tastes, smells, or sounds, engaging in repetitive movements like hand flapping, finger flicking, or body rocking, limited speech compared to peers and not talking as much as other children, reduced participation in imaginative or pretend play and repeating the same phrases. Autism in older children. Autism in older children may manifest through difficulty understanding others' thoughts or emotions, unusual speech patterns, such as repetitive words or phrases, echolalia, and one-sided conversation, preference for a strict daily routine, coupled with distress when it changes, intense fixation on specific subjects or activities, heightened agitation when asked to perform tasks, struggles in forming friendships or a preference for solitude, accompanied by difficulty expressing emotions verbally and a tendency to take language literally. Autism in girls and boys. Autism presents differently in girls and boys. While both boys and girls may present the previously mentioned signs, girls with autism may conceal certain signs of autism by mimicking the behavior and play of other children, withdraw in challenging situations, seem to manage social interactions more effectively, display fewer repetitive behaviors. As a result, identifying autism in girls can be more challenging. Strengths amid challenges. Although people with autism face numerous problems, they may also possess a number of assets, including the ability to study in depth and retain information for long periods, having excellent visual and auditory learning abilities, performing well in maths, science, music, or the arts. Causes and risk factors. While it is not possible to pinpoint the exact causes of autism spectrum, it is generally acknowledged that a combination of genetic factors and environmental influences play a role in its development. While scientists continue to investigate why some individuals develop autism while others don't, certain risk factors have been identified, including having a sibling with autism, being born to older parents, having specific genetic conditions such as Down syndrome, Fragile X syndrome, and Rett syndrome, being born with a very low birth weight. It's important to note that not everyone with these risk factors will develop autism. Range of the autism spectrum. The range of the autism spectrum highlights the diversity of experiences and challenges faced by individuals with autism. Understanding this range is essential for providing appropriate support and intervention tailored to each person's needs. Currently, autism can be classified into 3 levels to indicate the level of support an individual may need. Level 1. Requiring support. These individuals need some assistance with social interactions and may display repetitive behaviors or narrow interests. However, they can manage self-care and adapt to new situations. Level 2. Requiring substantial support. Those at this level struggle significantly with social interactions and communication and may need substantial help with daily tasks, including self-care. Level 3. Requiring very substantial support. These individuals have severe communication and social interaction deficits and often need extensive assistance in all areas of life. Differences between learning difficulty, learning disability, and autism. Understanding the distinctions between learning difficulty, learning disability, and autism is crucial for professionals working in education, healthcare, or social care settings. Although these terms are sometimes used interchangeably in everyday conversation, they have specific and important differences in clinical, educational, and legal contexts in the UK. Learning disability. A learning disability is a lifelong condition that affects intellectual ability and adaptive functioning. It is typically diagnosed when a person has significantly reduced intellectual ability, usually IQ below 70. Impairments in daily living skills, such as communication, self-care, or social understanding. Onset in childhood or early development. It can range in severity from mild to profound. People with a learning disability may also have additional needs, such as sensory issues, mental health conditions, or physical health challenges. A learning disability affects general intellectual ability, not just specific areas. Example, a person with Down syndrome may have a moderate learning disability and require lifelong support in learning and daily activities. Learning difficulty. A learning difficulty refers to specific challenges in one or more areas of learning, but does not affect overall intellectual ability. People with learning difficulties may struggle with particular skills but can otherwise function independently and attain high levels of academic or occupational success. Common learning difficulties include dyslexia, difficulty with reading and writing; dyscalculia, difficulty with understanding numbers and mathematical concepts; dyspraxia, difficulty with coordination and movement; attention deficit hyperactivity disorder ADHD, challenges with attention, impulse control, and hyperactivity. Example, a person with dyslexia may struggle with reading and spelling but have average or high intelligence and strong verbal or creative abilities. Autism spectrum condition. Autism is a neurodevelopmental condition, not a learning disability or a mental illness. It affects how individuals communicate, relate to others, and interpret sensory information. Autism exists on a spectrum, meaning that individuals experience a wide range of strengths and challenges. Some people with autism may have a learning disability, while others may have average or above average intelligence. Common features include differences in social communication and interaction, repetitive behaviors or highly focused interests, sensory processing differences, for example, hypersensitivity to sound or texture, Example: a person with autism without a learning disability may still require support with social interactions, managing sensory environments, or emotional regulation. Key distinctions. Please follow the table. Misconceptions and myths in public and professional settings. Misunderstandings about learning disabilities and autism remain common, even among well-meaning professionals. These misconceptions can lead to stigma, inadequate support, or misdiagnosis. It is essential to challenge these myths with accurate, respectful, and inclusive understanding. Myth 1. People with learning disabilities or autism lack intelligence. False. A learning disability affects cognitive processing, not value or potential. Many individuals with autism have average or high intelligence. People with learning difficulties such as dyslexia often demonstrate creativity, innovation, and strong problem-solving abilities. Myth 2. Autism is caused by bad parenting or vaccines. This has been widely discredited. Autism is a neurodevelopmentally condition with strong genetic and biological links. Parenting style or immunizations, such as the MMR vaccine, are not causes. Myth 3. People with learning disabilities can't live independently or hold jobs. With appropriate support and reasonable adjustments, many individuals live fulfilling, independent lives and make valuable contributions in the workplace. Myth 4. All people with autism have the same traits or behaviors. Autism is a spectrum. It presents differently in each person, from highly verbal individuals with subtle social differences to those with significant support needs. Myth 5. Autism is only diagnosed in males. While males have historically been more frequently diagnosed, research shows autism can be underrecognized in females, who may mask traits or present differently. Myth 6. People with learning disabilities or autism don't want social relationships. Many do desire connection but may face communication barriers or social anxiety. Assuming they are disinterested in friendships or intimacy is both incorrect and harmful. The importance of using person-first language and respecting identity preferences. The way we speak about people with learning disabilities or autism is more than just semantics, it reflects attitudes, values, and respect for their identity. Using appropriate, inclusive language is a fundamental part of person-centered care. As a care worker, the language you use every day has a real impact. It's not just about communication, it's about showing respect, dignity, and empathy to the people you support. Person-first language, putting the person first. Person-first language means speaking in a way that recognizes someone as a person before their condition. It helps to remind us, and others, that a person is not defined by their disability. Instead of saying a disabled person, say a person with a disability. Instead of saying an autistic, say a person with autism unless they say otherwise. Instead of challenging behavior, consider a person who communicates distress through behavior. This way of speaking encourages person-centered support, focusing on strengths and individuality, rather than labels or limitations. Respecting identity preferences, listen and adapt. Some people, especially within the community of people with autism, may prefer identity-first language like autistic person. They may see autism as part of who they are, not something separate. That's why it's important to ask people how they want to be referred to. Avoid making assumptions. Use their preferred language in care plans, records, and conversations. Why it matters in your role. Builds trust and rapport. Promotes inclusion and dignity. Helps avoid unintentional offense. Supports rights-based, person-centered care. Using the right language shows that you see the person, not just the diagnosis. That small shift makes a big difference in how people feel, respected, understood, and truly cared for. Thank you. You have successfully made it to the end of this module.